Hello everyone, it is me, Dr. Kelechi Eguzo, calling to you again. This Today we'll be discussing the overview of a topic called Approach to Clinical Breast Examination. This is part of the blended learning program on breast cancer clinical pathway. So in this module or in this topic, we hope that when we are done with it, you'll be able to describe the components of a focused clinical breast examination. So I want you to understand that the examination is not just touching the breast, but it includes taking history, a good history, and then inspecting the breast, palpation, and also palpating the lymph nodes. And I hope that at the end of this presentation as well, you get to understand some common errors people perform when they're what people make when they're performing their clinical breast examination. So I'll kind of just give you a rundown of what the topic is about so that as you're going through the materials, you'll be better guided. Okay, so why do we do breast exam? Basically, to evaluate a breast concern that the patient might have, or it can also be used to help as an adjunct for screening, especially in our setting where we don't have mammography. Clinical breast exam, when it is well done, becomes the only tool women have to be diagnosed earlier if they have any breast issue. And that is why we all need you to be able to understand this and do it properly. So the next thing, so in the handout, there are a bunch of other explanations to go through. But the thing you need to understand is that the steps to organizing it to doing a breast exam starts by getting yourself prepared. So that is like not just being in a hurry. And then remember to take history, do the inspection, examine the lymph nodes, and examine the breast in that order. The history, there are a lot of things to go through when you remember the risk factors for breast cancer. So the history is kind of where you're doing your screening and your risk assessment. And the history should include personal history of cancer, history of prior breast biopsy, and then up to the gynae history, that's such as menopause, and first pregnancy, and if they're using any contraceptives. And those other things are in the handouts. Okay? And I missed a slide there. But anyway, when you go on to examine the breasts, you should do some inspection. Remember, you start by looking, and you're looking for different changes such as a lump or dimpling, or you could even be looking for something like any skin color changes, like pudorrange, and of course remember to ask him to express if there's anything coming out of the breast. Okay. And when you're examining the breast proper, you should remember to use the pads of your hands as shown here and not the fingertips. Those help to make the breast exam more sensitive. And the breast exam is never complete without lymph node examination. There are details in the handouts and in the slides to show you exactly how these are done. And so it's important that you do a breast exam with excuse me, with lymph node examination. When I do this personally, I get the patients to put their hand above their head so that I get all the lymph node groups exposed, and that way I don't have to worry about switching hands or not switching hands. So it's important that you get to understand this. And then towards the end of the topic, when you read the slides, there's this talk about common errors people do when they perform breast exam. So I have to emphasize again: don't use your fingertips. Just remember to use the parts of your fingers, and don't be in a hurry. I mean, I understand that many of us have lots of patients to see, but if you are seeing a person that you're evaluating for her breast, take your time. And so that is like, I'm not asking to have fun on the breast, but rather be systematic and methodical. So if you're going to go the circular motion, which you find described in the handout, you should do that in a system, like do that systematically. And if you're going the up and down line motion, also do that systematically. That is something that would help you become better at doing breast examination. Okay. And so when you're done with the examination, if you find something that is suspicious, you could send the patient for imaging. If you have access to mammography, please use that. If you do not, and the person is young, say 40 or something, let's try and get them to do an ultrasound because ultrasound is more sensitive. And then the mammography, there's also this topic, we have a topic on mammography, so that is explained better. Now, if you find something that might be a mass, then the purpose of this course is to help you, guide you on how to do a biopsy. You can either use ultrasound to guide the biopsy, or you can just do a blind biopsy without using ultrasound guidance. And there is a video that I need you to watch, which is part of this module that talks about the blind biopsy. Then we also have some YouTube links for you to watch and to understand how biopsy is done and what to do and what not to do. Then if you suspect that this lesion is a cancer, let's say for instance you're seeing a woman, the breast is so big, you can feel the big mass there and she's lost weight and she's got all the features of breast cancer. I really wouldn't encourage you to waste our resources and your time on doing a biopsy first that you must have confirmed the breast cancer, but you start working her up for potential chemotherapy. And then while that is going on, we can always do the biopsy. I think that will save a woman's life better than having to want to check off all the boxes. I know biopsy done, this done, that done before you can start treatment. Okay, folks, that's the summary of this slide or of this topic, and I hope you enjoy it when you're going through the materials we've provided. Remember to do the post survey and then other surveys we've asked you to do, and engage us in the discussion groups. Thank you.